we have your Premier of British Columbia, David Eby, saying that the measles spikes across Canada are a result of anti-vax recklessness. I don't know how much more out of touch you can possibly be, because I would wager to bet that, in fact, it's public health and their handling of pandemic response and their vilification of people who opted to take a more wait and see approach than the top down, indiscriminately ordered COVID-19 vaccine mandate mantras we saw unfolding in the country over the last few years. I would say that is more to blame for any sort of vaccine hesitancy that has now grown than any sort of anti-vaccination. He refers specifically to anti-vaccination politicians. This guy's just out to lunch.
Well, this is one of those minefield conversations we have to have on a live stream on YouTube. So just to be clear, for the record, we are in no way going against the public health's advice in Canada or Dr. Bonnie Henry's advice. So, but yeah, I totally agree. There's obviously a huge lack of public trust. And it doesn't just spill over to the measles. If you look at the flu stats, for example, because remember, the flu just disappeared during COVID, and then all of a sudden it came back and you needed the flu shot again. Well, those rates have tanked completely, and they tanked even within the healthcare system, which, if you recall, British Columbia was one of the last places in the entire world to let go of their vaccine mandate against healthcare workers. So it was actually healthcare workers who were all COVID jabbed that totally were not getting the flu shot. So totally out of touch, and trying to take, of course, a stab at the strong opposition, the BC Conservatives, who actually in a recent poll are polling at 40, Main Street poll are polling at 44%. And the NDP is polling at 40% as far as who's got trust in them. So out of a touch. You would think at this point, maybe they're starting to realize, there's a lot of people who have regrets. I don't know anybody who regrets not getting COVID jabs. I know a lot of people who regret getting them. So you would think that they changed their tone, but it's the same rhetoric we saw before. And I see so many people cheerleading and on, like, oh yeah, thank God he's calling it out for what it is. It's like, but you guys have been saying this stuff, since 2020.
Yeah. Come on, give us something new to go off of here. But of course, Eby is just saying in this article, reiterates, he says the disease is no joke, and it has potentially serious impact of those infected and is preventable with 2 vaccine shots. Now, of course, we could not ever speak against that claim. And we all know vaccination is like the holy grail of science and medicine, and it is immune from criticism. And if you even so much as ask a question about it, well, you are a dangerous anti-vaxxer spreading medical misinformation who causes measles outbreaks across the country. So of course we would never do that, because who would want to be responsible for a measles outbreak? But I would say whoever's interested in learning a little bit more about measles, you could read the package insert, right? You can read the product monograph, what the manufacturer says about their own product. And sometimes the local health authorities, which we cannot question because they also are the holy grail of science and medicine and information.
They look like it too. They really do look like killers.
They are the truth. And you can contrast a little bit what they say versus what the manufacturer says about its own product, and just have a look around, see what you can maybe sleuth out yourself. But I wanted to note also in this article, this is crazy. So in Ontario, the article says Ontario reported its first death in the measles outbreak on June 5th. So that's just earlier this month, when, get this, a premature baby died after being infected in the womb of its unvaccinated mother.
What?
Yeah, sounds a little bit sketchy to me. So a premature baby died after being infected in the womb of its so the baby was born with measles
But it says
prematurely?
okay, after being infected. I thought it was saying died in the womb. Okay.
Yeah, it's really oddly worded.
Yeah, I bet you if we
Um,
dig, there's something super strange about that. And of
yes.
course, the baby, unfortunately, being premature had a lot of issues as well.
Exactly. And so that's the thing you have to look at as well as the other health factors involved in some of these cases that the media and these local health authorities capitalize on to spread fear
Mhm.
and gain your adherence to various things. So, you know, keep an eye out for stuff like that when the way that they word things. And for some reason, I don't know, I was reviewing YouTube's community guidelines earlier before ahead of the stream, and they don't actually include the World Health Organization. And I am a massive critic of the World Health
Mhm.
Organization. Don't get me wrong, but they have a vitamin A protocol on their website, vitamin A supplementation, which helps to reduce the impact of measles infection. So oftentimes there is a vitamin A deficiency involved in measles complications.
Mm.
And so supplementation, according here, I'll just share the link here because I would consider this a local, a health authority. I guess maybe it's not a local health authority, but there are some things that you can glean from somewhere like the World Health Organization. They call vitamin A supplementation an inexpensive, quick, and effective way to improve vitamin A status and reduce child morbidity and mortality in the long term. And so that is also in response to measles infections.
Mhm.
So, why don't we ever hear about that in the mainstream media reporting that there are
We
other steps you could potentially take, as well as, of course, going out to get your vaccines because they are obviously so safe and extremely effective.
Mhm.
Um, you don't hear about that stuff.
No, and I'm no you're raising a good point because I am noticing that our officials will point the finger at the WHO, but really they're cherry picking some of what the WHO is saying. And again, we're strong critics of the WHO, the World Health Organization. But an example, even with the ostriches that we talked about at the beginning, is you have the CFIA saying, well, the World Health Organization tells us to do it. But then when you actually read what the World Health Organization says, in this situation, they would say, no, don't call the animals. It's been past 28 days and they're in their own zone. So, yeah, you're raising definitely a good point there.